everyone, welcome back to my channel. If you haven't seen my previous YouTube videos, I'm Lisa and I am living in South Korea with my family. I have one son who's going to be 3 in a month and I'm pregnant, very pregnant, with my second child who is due in 2 months. So what I generally talk about on this channel is living in South Korea as an expat, is recently it's about being pregnant in South Korea and what that has meant for me in this experience. And then also just about, being foreign here and what to expect if you yourself find yourself a foreigner here in South Korea. So I hope in all of my videos that I can say something that is at least moderately interesting and useful more than anything for people. So today I wanted to do something a little bit different. Sorry if I get out of breath. That kind of comes with the territory. I thought it would be kind of interesting to go over my birth plan that I have here and talk about that aspect because it is a little bit different here in Korea, and I'm going to be honest with you, I haven't thoroughly read it, so I might be coming across some things that I'm like, oh wait, I didn't know that was a thing. But this is what it looks like. It's on Korean, there we go, Korea's standard A4 paper, which is a little bit longer and a little bit narrower than 8.5 by 11. This is what they put everything on. So if you have a standard 8.5 by 11 folder, it usually sticks up over the top. But anyway, this is my entire life right here as far as my pregnancy goes. Every ultrasound, every appointment, and I can actually talk a little bit about this too, which is interesting. So before I get into the birth plan, I'll show you this. At the end of every appointment that I have, this is in Hangul, by the way, so I can't read any of that, but this front sheet, this is in English. And this right here is my patient number and my name. And what they do is, it's very interesting how they do this. They use this to know who you are at all times. So they give me one of these at the end of every appointment for the next appointment. That way, no matter who I'm going to go see and what I'm going to go do at the hospital, I hand them this piece of paper and we don't have to talk at all, which is great because I don't speak Hangul. So they scan this barcode, and the barcode tells them who I am, what I'm there for, when my appointment is, who I'm there to see, and we don't have to have any conversation. And then also this is kind of like a cheat sheet just for me about what I'm doing this time. So next time, oh, that's the wrong one. This is next time, 5/8. I'm having an ultrasound and I'm meeting with my doctor. So I know that. So I have one of these for every single time I've gone to the doctor, which is quite a few because I'm in my 3rd trimester. So that's just a little tip. I didn't actually understand that until probably my 3rd or 4th appointment, where I was like, oh, I can just hand them this or tell them my number, and it's universal throughout the entire hospital system, exactly who I am and what my issues are. So I thought that was really interesting and a kind of like neat way to do it. It's really important for them in particular because Koreans only have a certain number of surnames. It's a ridiculously low number, but it's not like 40. But it's like 150 or something like that. So a lot of people end up with the same name. And so for them, like, my name is totally unique. I can guarantee you I am the only one with my name in Korea. But for them, there's a good chance that they could have the same name as someone else, maybe even with the same issue. So they have to use this numbering system to tell everybody apart. So anyway, that's that. This I was handed, and it says birth plan at Severance, which is the hospital that I am going to for my prenatal care. And I was handed this at my 8-week appointment when I first saw my doctor, which was really confusing to me because usually you don't talk about birth plans at all with your doctor in the States until like end of second trimester, third trimester, if at all. So I was like, wow, I guess we're in this together, when I got this piece of paper. So, the first thing it talks about is room options. That's the first section. And it says patients will automatically be provided with a private room, which will include a bathroom, small refrigerator, lockable wardrobe, and personal phone. Interesting. For the delivery, a private room is provided depending on the room availability. You can upgrade to deluxe room or downgrade to a general room, which is 4 patients per room. First, check your insurance plan. Rooms are subject to room availability on delivery date or surgery date. This means we cannot guarantee you the room of your preference. It's pretty boilerplate. And then if they can't give you what you want, they'll transfer you once one becomes available, which again, seems pretty standard. When should I come in? Over 37 weeks. And then they break it apart for a vaginal delivery versus cesarean. Various things like that. And then prior to, and then prior to 37 weeks. And then they list all of the potential things that could be like red flags for you to come in. Then they have this great map right here, which if you've seen my other YouTube videos, you know that I had to actually use this map when I was trying to find the children's hospital when I had an upper respiratory infection, because any issues that a mom has while she's pregnant, you go to the delivery room. Any issues at all. So I thought I had the flu, so I called my doctor and told her what my symptoms are, and she told me to go to the delivery room. So we had to find it, and it was a great dry run for us. So now we know exactly where it is, but I used this map to find it when I first went there. So it actually was really helpful to have this birth plan way, way, way back before I was actually going to need it for birthing. So they just know, I guess. Right, so they go over parking with that. So then they go to things to pack, which is nice to have. So for mother, toiletries, sanitary napkins, and books to read, which I think is an interesting add-on. They don't say like entertainment, they say books in specific. Socks, underpants, nightgown, maternity underwear, including nursing bras. For baby wipes, which is so funny because in the States that is something that is totally standard to be, I don't know why my hair is doing this, totally standard for the hospital to provide. So it's an odd thing to have to bring. Receiving blankets, baby clothes, and diapers. Again, totally standard for the hospital to cover that in the States, but in Korea, it's not. And then if you plan to breastfeed, nursing bras, breast pumps, related equipment, bottles, and formula if you plan to bottle feed. So all of that is on you to bring. Interesting. I think I will probably do a follow-up to this as well because my friend Teresa just had a baby a couple months ago. And I have another friend who gave birth a couple months before that. So both at Severance, both at the same doctor that I have. So hopefully I will be getting one or both of them on here soon to talk about their experiences. And I know in particular that Teresa has a number of things that she wished that she packed in her hospital bag that they didn't list here. So we're going to have to talk to her about that pretty soon. For the birth partner, husband may stay with the wife during labor and delivery, which, if you know anything about Korean custom, is very new. They did not typically let husbands stay in the delivery room with their wives during delivery at all. It was typically something for the mother-in-law and mother and maybe a sister, but that was it. So However, we will ask the husband to leave the room during some procedures, which I'm going to talk about in a minute. In case of cesarean section, husband is not permitted to be present inside the operating room, which is different than in the States, where typically the man, the husband, partner, would stand up at the head, kind of at the woman who's giving birth's head, and there's a sheet that kind of covers everything up so that they don't see anything too gruesome. So that's not the case here. They don't even let them in the room. And cesareans are very common here. So maybe that harkens back to those old school ways of doing things. I'm not sure. So then it goes into labor. This is a section called labor. Enema will be done on admission. Period. That's a statement. They're not asking that question. So I wonder how much wiggle room there is for that, because that is not typically something that we would do in the States. But it might be something you just have to kind of get on board with if you're giving birth in Korea. IV fluid line will be obtained on admission. Oxytocin drip will be done if indicated. And I'm not sure, maybe that's a rough translation or what. Epidural is available for pain relief with your consent. For more regarding the epidural, see page 7. So this goes on for a while. Analgesics will start when the cervix becomes dilated to 4 centimeters. That's very specific. There's just so many kind of strange sections. Like, I feel odd reading this to you guys, but at the same time, I don't want you to miss anything. So, when the cervix is fully dilated, epidural may be stopped for efficient pushing. Aromatherapy, vaginal delivery after cesarean section, sophrology delivery, I'm not even sure what that is, chair delivery, and pool delivery are not performed. So they do no VBACs. They don't do whatever that sophrology thing is. They do not deliver in chairs or in pools or provide aromatherapy. I really wouldn't think of that as an option, but however, the mother will be allowed to move around during inactive phase. If it is indicated, so if you're using basically oxytocin, which is, what do we call it in the States? Pitocin, which is the synthetic version, or an epidural, you will not be allowed to move around. So there you go. They're not really looking for much debate on this, is what it seems like. Delivery. Mother is placed, in lithotomy position, which I'm guessing is on your back. Yeah, here's a good one. Episiotomy is given on needed basis. I've heard that they give episiotomies here like gangbusters. So that's going to have to be something that I talk to my doctor about. So I've heard that they kind of do it as a rule. And once again, I have no idea how much of this is really up for debate with my doctor, but I feel like my doctor and I have a pretty good rapport, and she sees me as a somewhat independent, very independent and strong-minded person. So I'm hoping that there is some availability for us to discuss these things. This is a nice dramatic one. Following expulsion of the baby, umbilical cord is cut and nose will be aspirated. Okay. The father may cut the umbilical cord. If you want this, please tell us in advance. Following spontaneous delivery of this placenta, oxytocin drip will be intravenous for uterine contraction. Intravenously, okay, more oxytocin, I guess. Baby's APGAR score and the general physical examination are taken immediately after delivery. The mother will be allowed to hold and nurse the baby for after immediate checkup for better attachment. I've heard this is actually kind of crap, and this is where we really need to talk to, or I include you in all of this, where talking to Teresa and my other friend Alicia will be useful because they know how long that they were allowed to have the baby for. And based on my somewhat segmented conversations with them, I've heard it is not very long that they're allowed to have the baby. And it's certainly not immediately. The baby is immediately taken to check the APGAR score. And then only if everything checks out do you get the baby back again for some length of time. And I think it's actually quite short. So again, this is something to talk to my doctor about. And if episiotomy was done, repair will commence. After delivery. So this is where it gets really tricky. The baby is taken to the nursery for a comprehensive checkup by pediatric specialists, bath, stabilization, for 4 hours. So, assuming that you don't get very long with the baby when the baby's first born after that APGAR test is done, you could theoretically not get the baby again for 4 hours. Father should accompany the baby to the nursery for identification. I don't think that's going to be very hard in our case. If the mother wishes for breast milk feeding only, please inform the nurse at the nursery, which is not in the same place as the delivery room. However, when medically indicated, the baby will be fed with formula. I guess they get to decide what is medically indicated. The mother is to stay at the delivery room for 2 more hours in order to monitor blood pressure and bleeding. Sips of water or ice chips is allowed during this 2 hours. If no immediate postpartum complications are noted, she will move to the general ward. When she is moved to the general ward, the baby has been stabilized. Rooming in will begin. There's a lot of caveats to that I will talk about later. If the mother has contraindication to nursing, who uses that word? Nobody. Formula will be given to the baby. The mother should begin a hot sits bath for 6 hours following delivery. If you want a birth certificate in English, request one the day before discharge. That's going to have to be a thing. And it will be provided on the day of discharge. Also, those cost money at the hospital, by the way. Like $25-$30 a piece. Rooming in. So here's the real juicy part. Rooming in after birth is when your baby stays in your room with you, as opposed to staying all day in the nursery. Rooming in allows you and your husband to give total care to your baby in a home-like environment, even in the hospital. It is beneficial for breastfeeding if you're able to learn more about your baby's feeding signals and are able to respond promptly. Also, it helps you and your baby become better acquainted. Below is the rooming in policy. For the safety of your baby, we offer rooming in during daytime only. Please pick up your baby. Like it's, I don't know, some sort of like van ride share program. Please pick up your baby at 9 a.m. and return the baby to the nursery by 6 p.m. What? However, if you want to spend more time with your baby, rooming in is acceptable from 9 a.m. to 9 p.m. Also, during nighttime, you can visit the nursery for breastfeeding. But how do you know when to breastfeed if your baby's not there? And it's only allowed, rooming in is only allowed when you stay in a private room or a VIP room. The primary caregiver for the baby at home and support person for backup must always be present at all times during rooming in hours, meaning you cannot be alone with the baby. You have to be with another person. Good God. Like, it's pretty frustrating, actually. Never leave the baby unattended. Well, okay. Always wash your hands. Don't allow in visitors. Keep the baby's delivery record up to date. Call when a warning sign is noted. At the nursery, you'll be asked whether or not you want to have the baby tested for blood type or congenital metabolic diseases. Vaccination will be done in your consent. Blah, 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 blah. Discharge plan, 2 nights after delivery. You're ready to go home, take the payment and receipt of your baby's Take the payment receipt and your baby's clothes down to the nursery. The nurse will dress the baby and then hand the baby to you. The nurse will give you the vaccination schedule and discharge instructions for the baby as well. Now you're ready to leave the hospital. For more details, please refer to the discharge instruction sheet. There's a lot more. There's instructions on what labor is. There are discussions of what complications could arise. Pain control. Cesarean section information. There's diagrams. This is the part I haven't really read. Oops. Oh, there's a section called Will It Hurt? I think that's nice. Anesthesia prevents pain during the procedure. Although you may feel some pressure, tugging sensations as well as the uterus is opened up and the baby and the placenta are removed. After surgery, if you have an epidural in place, your surgeon may give you pain medication. There you go. Cesarean explained like that. And more on the cesarean section. So that is generally the birthing plan from Severance Hospital here in Seoul. I am a little bit nervous about some of that stuff. Hopefully my doctor and I can come to a good understanding about it, but I have to imagine that a lot of that is just simply hospital policy. And no matter how much I rage against the machine, it's probably not going to do much good. So we'll have the discussion. Anyway, thank you for watching. Thank you for enduring me walking through my birth plan. I hope that it was in some way interesting to you. And I certainly hope to open this up for further discussion. If anyone has anything of note that they would like to contribute to this conversation. I obviously haven't done any of this yet. And even though I have friends who have, I'm not 100% sure of their experiences yet. So I would really like to, if you're interested, bring them on and have them talk about what their real actual birthing experience was. And please leave comments, questions down below. I'm happy to investigate any of this further that any of you might have questions about. And on that note, I think I'm going to go. But thank you guys so much for coming to listen to me and for having this conversation. And I really look forward to engaging with you in the future. So goodbye for now, and I'll see you soon. Thank you.